What motivated to choose Osmania? Sir, how department works at Osmania? Sir? How much time it takes to accomplish all this, sir? Initially, how many patients will come, sir? OP, footfall. Sir, can you say about the department timings and how many duties per month you will get, sir? Yeah. Sir, as Telangana is having only one MNG Cancer Institute, how are the advanced equipments here, sir?
I love Osmania Medical because since my UG days and now.
Sir, how is the senior junior?
Basically, radiation oncology department itself is very new to the undergrad.
Yes, sir.
Initial days will be tough.
Footfall. Sir, per day, how
Footfall will be around 100.
Sir, okay.
And OPD closes by 4 o'clock.
Sir, how is
Department is too good.
Yes, sir. Sir, as a Telangana,
You will be given free hand to control.
from first year only.
Yes, from first year onwards.
Sir, after completion of the PG, what is the scopes and the salaries outside corporate hospital, sir? Hello guys, welcome to our YouTube channel Osmania Docs. Are you planning to take Osmania Medical College in NEET PG counseling? Let me give you a residency life here. Myself Anil, and today we have our senior Dr.Sagar sir, who completed his Radiation Oncology in Osmania Medical College and senior residency from Osmania Medical College, and currently practicing as a senior registrar in Indo-American Brachytherapy Cancer Hospital. Hi sir.
Hi Anil.
Sir, when did you choose Radiation Oncology as a dream branch, whether in the internship or completion of the NEET PG exam?
So to be frank, actually I don't have any idea about radiation oncology in my UG days, even in my internship. Basically,
We don't have
postings
Ah,
in
yes, sir.
radiation oncology. So I got to know about the branch only after my NEET PG results.
Okay, sir.
So later I digged into it and I liked it.
Okay.
Then I was getting seat in the same Osmania Medical College. Since I've done my UG from same college,
Yes, sir.
I'm more inclined, and I went and I got to know about the department, and finally I
Sir,
settled in radiation.
what motivated to choose Osmania?
So basically, first thing is I love Osmania Medical College because since my UG days and all.
Yes, sir.
Okay, so second thing is like when I got to know about the radiation oncology department, so it's completely like it's basically onco part will not read in UG days, even in the preparation also. Onco is kind of skip
Yes,
because
sir.
of staging and all.
Yes, sir.
Okay, so I affiliated hospital is MNJ Cancer Hospital to the Osmania Medical College.
Yes, sir.
So there we have 3 departments, basically medical oncology, radiation oncology, and surgical oncology. Any cancer patient has lot of basically at least 80% of the solid malignancies require a radiation at least as a part of the treatment.
Yes, sir.
Okay, so basically cancer treatment will require all 3 departments at some point of the treatment.
Yes, sir.
So in MNJ hospital we have 3 basic radiation machines and there is one advanced machine. Okay, and we have brachytherapy setup also.
Okay, sir.
And we'll get exposure to chemotherapy here.
Okay.
So I searched about other institutes, and few institutes are not like they are not doing chemotherapies. Basically, entire chemotherapy is given by medical oncology in other institutes.
Yes, sir.
Here we do have exposure to chemotherapy for solid malignancies.
Okay.
And we are getting exposure to completely in the radiation therapy. And then we have brachytherapy set up here.
Yes, sir.
So all these things, I thought I'll join to MNJ Hospital and Osmania Medical College.
Okay, sir. Sir, how many PGs are there in Osmania in Department of Radiation Oncology?
So for now we have 14 PG seats.
Okay, sir. 14 first year, 14 second year, and 14
Yes,
third year.
yes.
Sir, how many senior residents are there?
Senior residents for now it is 5.
5. Okay, sir.
Basically, recently we had one new unit coming up.
Okay, sir.
Okay, previously it was 5 units, so
Okay, sir.
each unit had one senior resident.
Okay.
Maybe in the next year you might get 6 senior residents.
Okay, sir. Sir, how department works at Osmania, sir? Whether in which year, what postings you have, sir? So kindly give a brief about that.
Yeah, basically the radiation oncology department itself is very new to the undergrads.
Yes, sir.
I think maybe at least 10 or 15% of the UGs will get exposure to radiation oncology in their UG days. I don't think rest of all other people, at least 70 to 80% will not know anything about radiation oncology. It's completely a new branch, just a century old.
Yes, sir.
I think around 1900 starting in the early 1900s,
It has evolved
this
much.
has come into the picture.
Yes, sir.
Okay. So we'll have to read radiation biology and radiation physics. It's completely new to the undergrads. You have to go back to your intermediate physics days and you'll have to learn basics about how the radiation works, how photons work, how protons work, how electrons work, how you can use that to treat the cancer.
How much time it takes to accomplish all this, sir?
Yeah, initial days will be tough. You'll have to learn the basics into the basic science of this radiation.
Okay.
Okay, so and treatment is not like you are sitting in the OP and prescribing some medication and writing some dose, and you are counseling the patient to take those medication as per advice. This is completely different thing.
Okay.
It's so basically radiation oncology. Like in 3 years residency, you'll have to learn about cancer management as a whole, whether it is medical management, surgical management, and management from radiation. Okay, and along with this, you'll have to learn something about chemotherapy. Okay, and from the Osmania department perspective, okay, we have 6 units here, and 3 years PGs have to take about. You'll have patients admitted for chemotherapy, and you'll have patients admitted for complications of radiation.
Okay.
You'll have to take care of all these patients. Okay, so first years will have to take rounds every day.
Okay.
For chemotherapy patients and for radiotherapy patients.
Okay.
And second years and third years will give their guidance.
Okay, sir.
And final grand rounds will be like any other department from the consultant.
Okay.
Okay. So along with this, the workflow is when a patient comes into your department OPD, either through referral or through directly walk-in OPD. So you'll have to take the assessment, and then once you decide to give the radiation, you'll have to take one simulation scan in particular precise position, which has to be reproduced every day. Okay, so and after that, you'll have to contour on that scan, and on that, medical physicist will be planning on that, and you'll have to evaluate that plan, and you'll have to implement. So this is the basic radiation oncology workflow.
Okay.
This is for external beam radiotherapy.
Okay.
There is something called brachytherapy that will be delivering radiation within the body, like
Yes, sir.
internal radiation. Okay, so for that, again the setup is different.
Okay.
So once the patient comes into your OPD and you decide to give, the simulation has to be taken care. Technologists will be there to take simulation, and you'll have to assist them.
Okay.
Then contouring part. Contouring part is like major chunk of radiation oncology. Okay, so there will be something called organs at risk. There will be something called gross tumor volume, clinical target volume, and PTV.
Okay.
Okay, final plan will be delivered to the PTV.
Okay.
So first years will be contouring the organs at risk, and from second year onwards, you will be allowed to contour clinical target volumes and tumor volumes.
Okay.
Okay, so once the plan is done, plan evaluation will be done by final years and senior residents.
Okay.
Okay, and implementation, again everyone has to be in that implementation part, and every week you will have to follow up the patient.
Okay, sir.
For any toxicities, any complications, any requirement of concurrent chemotherapies, or any change of plans, or any change of how the tumor is responding, and whether you need to replan again based on the adaptation.
Okay.
So this is the major workflow. So for our department, first years will be taking care of organs at risk, rounds, and this thing, implementation part. Okay, and second years and third years will be doing and second years and third years will be guiding these getting these procedures.
Okay.
So, and brachytherapy part, you'll have to first years have to assist the second years and third years. Once they are like learning curve will be there in the initial stages.
Okay.
Once you get to know about the procedure and all, then you'll be given free hand to do it on your own.
Okay.
And all these things will be monitored by consultants.
Okay.
Okay. So,
Sir, per day, how many patients will come, sir? OP footfall?
OP footfall will be around 100.
100.
Around 100 every day.
Okay.
Basically, it's not the 100 new patients, but already registered patients will come into the OPD for reviews, RT reviews, and for chemotherapies.
Okay.
Okay, so at least every day OP will be 100 at least.
Okay. Sir, can you say about the department timings and how many duties per month you will get, sir?
Yeah, OPD starts at around 9:15, 9:30.
Okay.
So before that, you'll have to finish the rounds, ward rounds. So first year PGs, maybe in initial days, you have to come by 8 o'clock.
Okay.
And OPD closes by 4 o'clock.
Okay.
Okay. Some days, like you'll have work in machine side, implementations and plannings.
Okay.
That will be allotted differently. Okay. But the department overall workflow will be finished by evening 5 or 6.
Okay.
So 8 to 5 or 6.
Okay.
This will not be on daily basis. So on new OPD days and review OPD days, it will be the workflow.
Okay.
For counterings, you might have to stay extra.
Okay.
Okay. And duties will be on rotational basis. One first year, one second year, one third year will be there on
Okay.
each duty.
Okay.
So per month, maybe 3 or 4 night duties you'll get.
3 or 4.
Yes.
Sir, how is the senior junior? Is there any
So,
toxicity? As the radiation oncology is completely a different branch, we don't have any exposure to the in undergraduate and internship postings. Will the seniors guide everything?
Yes, definitely. Department is too good actually. So everyone will be guiding you.
Okay.
There is no toxicity.
Okay, nice, sir.
Not for camera's sake.
Okay.
Basically, department itself is like it's very good.
Okay, sir. Sir, what about the academics, seminars, theses?
Yes, academics will be there. One journal club will be there and one case presentation. Case presentations will be done by second years and third years. First years will do journal clubs and topic presentations. Okay, so every day morning you'll have one class.
Okay.
And afternoon classes there will be interdepartmental classes like multidisciplinary tumor board meets will be there, and palliative care medicine classes and nuclear medicine classes will be there. Academics are very good.
Okay, sir. Sir, as Telangana is having only one MNJ Cancer Institute, how are the advanced equipments here, sir?
Yes, so there is one more government department in Kakatiya Medical College also.
Okay.
But I don't think they have PG seats.
Okay.
Okay, so this MNJ hospital is the sole government hospital for post graduation.
Yes, sir.
Okay, so here we have linear accelerators. 4 linear accelerators are there. There is one DHX machine, one 600C machine,
Okay.
and one TrueBeam,
Okay.
and one Halcyon. Okay, so it's on par with the corporate hospitals.
Okay.
Okay, so basically in the initial days there used to be Cobalt 60 machines.
Okay.
So that is like conventional way of radiation. We cannot do IMRTs, IGRTs and stereotaxis on that.
Okay.
Okay, so toxicities will be more. Here we have these 4 advanced machines. We do a lot of IMRTs, okay, and IGRTs. Stereotaxis will be done for brain metastasis, and even few benign cases will treat here.
Okay. Sir, is there any procedures and hands-on?
Yes.
What procedures is this?
This major part is contouring and
Okay.
brachytherapy. For the brachytherapy, you need hands-on.
Okay.
Okay, so you'll be given free hand to contour.
From first year on?
Yes, from first year onwards. There will be division, like first years will do organs at risk, second years and third years will do target volumes.
Okay.
Consultants will ultimately edit and they'll teach you what are the mistakes and then you will give for planning.
Okay. Sir, is there any hostel for PG postgraduates, whether it is affiliated to Osmania here only or is there any MNJ?
No, it is affiliated to Osmania Hostel.
Osmania Hospital
Osmania
only.
Medical College Hospital.
Okay. Sir, coming to what are the super specialty scopes, sir, in department?
Yeah, super specialty part wise, like radiation oncologists are eligible for appearing medical oncology.
Okay.
Okay, and there are some institutes offering super specialty course in radiation oncology. It's 3 more years,
Okay.
site specific. Okay, so these two, and medical genetics is also, for medical genetics also you are eligible. Radiation oncologists are eligible.
Okay. Sir, as many of the are commenting, as nowadays chemotherapy is evolving and monoclonal antibodies are developing. So many of them is thinking is all this impact on radiation oncology.
No, basically, cancer itself is like oncology itself is a very much evolving field. Every day guidelines will change, and every day new data is coming up and new treatment modalities are coming up. Okay, so still there is scope for radiation oncology. There is at least 80% of the solid malignancies will require radiation at some point of their treatment. Okay, so even with the advent of new chemotherapy drugs, new immunotherapy drugs, still there is role of radiation in each solid malignancy.
Okay.
Okay, and so even in hematological malignancies, few cases will require brain radiation, few cases will require total body radiation
Okay.
for transplants. So scope is still there, radiation role is there in oncology.
Okay.
Definitely, and lot of malignancies have radiation as the only source for cure. Okay, even with the advent of new immunotherapy, chemotherapy modalities, and surgical modalities,
Okay.
a lot of sites require, in lot of sites, radiation is the definitive treatment.
Okay, sir.
Okay.
Sir, after completion of the PG, what is the scopes and the salaries outside in corporate hospital, sir?
Yes, once you come out, immediately after finishing your MD, you will have senior residency options. Okay, in senior residency, you will be getting around 80,000 to 1,20,000.
Okay.
And post senior residency, uh, it varies basically.
Okay.
These setups are not so common. They are mostly into tier 2 cities now. So, as a radiation oncologist, you will require machinery. Without machines, you cannot deliver. Okay, so you need a setup. For in villages and like low level district towns,
Okay.
definitely it is not possible.
Okay, sir.
Okay, you have machinery in tier 2 and tier 3 cities. Okay,
In and around how much cost it will take to set up a clinic, sir?
yeah. That will be very huge budget
Okay.
in crores.
Okay.
I mean, not in crores also, actually tens of crores.
Okay.
So, you'll payment post senior residency is different across the. It basically depends on where you are working. If
Okay,
you are
sir.
working in good metro cities, payment will be something around 1.5 to 2 lakhs.
Okay, sir.
And there are chances. I mean, payment is much more if you go to north.
Okay.
Okay, and options are like if you want to plan for abroad, there is something called fellow in Royal College of Radiologists, FRCR.
Okay.
Okay, that will add up. Like salaries will be more if you do that.
Fellowships.
If you do that fellowships and plan for abroad. Okay.
Sir, how is work-life balance in department, sir?
It's pretty good. So you'll not have more night duties.
Okay.
Okay. So in residency, you might get monthly 3 or 4 duties, and post residency, mostly if you are available on call, that's fine.
Okay.
If you are practicing only radiation oncology without chemotherapy, it is even more like you don't have to come in night times and do emergency procedures.
Okay.
Okay. So in onco, there are some emergencies which will require radiation, but mostly it's not like once you get a call, you have to immediately give radiation. Okay. So you'll manage medically for that night, and next day morning you can
Evaluate and we can
plan
go
for radiation.
radiation.
Okay.
Sir, as many of them is feeling radiation oncology is saturated, what do you say about that, sir?
Yes. Basically, more PG seats are coming up and more radiation oncologists coming out. but centers, their centers also increasing in number, but not in proportion.
Okay.
So saturation, it's kind of, it is there if you want to settle only in the, only in Telangana.
Okay.
Lot of opportunities are there in if you are okay to move to tier 2
Other
cities
states.
or other states or abroad.
Okay. Thank you, sir, so much for spending your valuable time and giving genuine information about the residency life. Please like, share, and subscribe for more content related videos. Thank you.
Okay.